Good evening from New York. I'm Chris Hayes. As we prepare to observe Memorial Day and pay tribute to the American servicemen and servicewomen who have died for our country, and including recently the wars that we are still fighting to this day, we're also likely to cross the threshold of 100,000 documented deaths from coronavirus here in the United States. We have by far the highest documented death toll in the entire world. U.S. fatalities make up a little under a third of the global fatalities, and we are almost certainly undercounting those numbers. The president has decided, for the first time, as far as we can tell, to show in any small way some small marking of the mourning and the grief of this nation by ordering flags to fly at half staff starting today through sunset on Sunday. Flags will be lowered again on Monday for Memorial Day. What's so striking about this gesture to me is how absent it's been, how utterly absent for the past 12 weeks that have passed since we first got news of the first U.S. death. In fact, often when the president talks about the people that we've lost to the coronavirus, he sounds like this.
You know, we've become very good at this. When you look at what's happening, when you look at the numbers coming down, a lot of states are in really great shape.
I think we've done a great job. As you know, minimal numbers were going to be 100,000 people. Minimal numbers were going to be 100,000 people, and we're going to be hopefully far below that.
Our death totals, our numbers per million people are really very, very strong. We're very proud of the job we've done.
Our numbers per million people are very, very strong. Just to be clear here, when he says numbers, when he says our numbers, what he means is deaths. He's talking about deaths of our fellow Americans. He's saying he's very strong on. And I have to admit, I think there's some part of me that's gotten a little numb too, actually. Processing it all has started to feel impossible. In the early days of the pandemic, it feels like a lifetime ago, right? When shelter-in-place orders started, the grief felt palpable and overwhelming. I mean, people I knew were getting sick, very sick. People were working ERs. People I knew were losing loved ones. Early in the lockdown, I lost a dear, beloved uncle myself, not to coronavirus, but losing someone in this weird situation where you cannot get together to mourn collectively or properly memorialize or hug your loved ones was awful and kind of overwhelming. There's been this very ghastly, cynical play, a sort of bet made by certain elements in our politics that people will just get over it. They'll get numb to it. So every day ticks by with just an unfathomable number of deaths. Yesterday it was over 1,300. You get lulled into this perverse thinking, well, that's better than over 1,500 a few days ago, and it's coming down. The trend is in the right direction. That's still a 9/11 in this country every 2 days. It's still oceans and oceans of grief and loss and memory and ache and pain and trauma. It is still an untellable number of stories. And we have tried to take a little time every week to tell a few of those stories, just to remind us all about the real, actual flesh and blood human toll of what's happening. Like Dr. James Charlie Mahoney, he's a pulmonologist at a University Hospital Brooklyn, a pillar of that hospital system. And Dr. Mahoney was planning to retire. But when the pandemic hit, he decided to keep working to help treat those in need. As a fellow doctor described it, he was handling patients and codes every 5 to 10 minutes. He was doing everything he could. Another colleague called Dr. Mahoney one of our legends, one of our giants. His daughter Stephanie described her dad's friendly, talkative personality, which made him a favorite among colleagues and patients.
They kind of had to put a sign, I think, on one of the doors of his office saying, like, don't ask Dr. Mahoney about the following topics or else you'll be in there for too long.
Dr. Mahoney died on April 27th of the coronavirus at the age of 62. Peggy Dubisi was a social worker for nearly 30 years. She arrived in New York City in 1980 as an exchange student in Nigeria, devoted her life to helping others. Her family describes her as determined to stand on her own, even after she fell into homelessness in recent years, after losing her longtime apartment in a fire. She died of the virus late last month. She was 59 years old. Her sister says she is heartbroken that Peggy died a very lonely death and just wants her to be remembered. Wilson Roosevelt German. Now, you may have heard of him. He was one of the longest serving employees of the White House. He started his career in 1957, if you could believe it, as a cleaner during the Eisenhower administration. He was promoted to butler during the Kennedy presidency and retired as an elevator operator for President Obama. His granddaughter said he was so proud to work for them, so happy to see a person of color as president. He never, ever thought that in his time at the White House, he would see something like that. According to his granddaughter, he had no shoes as a child in North Carolina in the 30s, walked 6 miles to school, had to drop out at the age of 12 to work on a farm. What an astonishing, what a remarkable life this man lived. What incredible history he got to see up close and be a part of. And he died last week of the virus at the age of 91. And that's a ripe old age. I mean, one of the facts about this virus is it really has disproportionately affected the elderly. 80% of deaths in the U.S. have been among people 65 and older. In most states, at least a third of the deaths have been people in long-term care facilities. And at the edges of our discourse, and sometimes creeping away from the edges and towards the White House, is this idea, it's not often said, but it's there, that yes, it's bad, but, you know, mostly it's killing the old and then the sick and the poor. Just think about that for a second. What kind of government? What kind of society? What kind of people says, well, it's mostly killing the old and the immune compromised and the people have to work next to each other in slaughterhouses or drive buses and subways. So really, when you think about it, I mean, really, when you really think about it, the risk to everyone else is pretty low. A Georgia man interviewed by the Washington Post said it loud and clear, quote, "When you start seeing where the cases are coming from, the demographics, I'm not worried." This pandemic is a challenge and a test of our federal government and our local governments. The federal government has thus far failed us. But it is also a challenge for us, for our society, about what we value and who we value and how we express that we are looking out for each other. And so on this Memorial Day, as we pay tribute to those we've lost as members of our armed forces through the years, there are also some things we can do, things we can demand of our government so that we honor the lives of those also lost to this pandemic. The president's going to fly the flags at half-staff for 3 days in memory of almost 100,000 Americans we have lost to the virus. 3 days, and then we move on, I guess. We are living through an American catastrophe. More people will die, so let's continue to remember them. And let's help those who are trying to mourn their dead in the midst of the historic unemployment, the worst economic downturn since the Great Depression. The President of the United States can authorize FEMA to release money to pay for funeral costs for those who can't afford it, to help people. We have done it in the past, but the President of the United States has not released those funds. So why not help Americans bury their loved ones with dignity and grace? These are not hard things to do. It is not too much to ask. Just because our president has failed us does not mean that we have to fail, does not mean that we cannot demand more.